Learning hand surgery, one point at a time. The static cockup splint is worn on the front of the forearm and hand. It lifts up or cocks up the wrist and holds it in that position to help in the acute stage only. Flexion movements of the fingers will be possible. The dynamic cockup splint will automatically keep the wrist in extension, but the patient can actively flex the wrist. This splint will not support the fingers, but active movements of flexion and passive extension at the wrist will keep the forearm muscles stretching and relaxing passively, and this will ensure that there is no undue stretching or atrophy of the muscles, and the motor end plates are also kept alive. The dorsal pull outrigger splint keeps the wrist in extension, and the outrigger straps lift up the proximal phalangeal region of the fingers to keep the metacarpophalangeal joints in passive extension. The patient can actively flex the fingers against resistance provided by the rubber band traction on the extensor aspect and hence strengthen the flexors of the fingers.